Hello everyone, and welcome to our discussion about a medication known as Seroquel. As always, this information is intended for educational purposes, and any health-related questions or concerns should be directed to a healthcare professional. Description: Seroquel, with the generic name quetiapine, is an atypical antipsychotic medication used to treat several mental health conditions. It is prescribed to treat schizophrenia in adults and children who are at least 13 years old. Seroquel is also utilized to manage episodes of mania or depression in patients with bipolar disorder, either alone or in combination with D-valproex or lithium. Furthermore, it is used with other medications to prevent episodes of depression in patients with bipolar disorder and is also employed in treating major depressive disorder in adults when used in combination with antidepressant medications. Seroquel works by altering the activity of certain natural substances in the brain. Warnings: Seroquel comes with a set of warnings. High doses or long-term use can cause a serious movement disorder that may not be reversible. The longer you use Seroquel, the more likely you are to develop this disorder, especially if you are a woman or an older adult. Additionally, Seroquel may increase the risk of death in older adults with mental health problems related to dementia. It's also crucial to note that taking antipsychotic medicine in the last 3 months of pregnancy may cause serious problems in the newborn. Before taking this medicine. Before starting Seroquel, it's vital to inform your healthcare provider if you're allergic to quetiapine. It's also essential to discuss your medical history, especially if you have ever had a nervous system reaction associated with antipsychotic medication use, heart disease, a heart attack or stroke, long QT syndrome, an electrolyte imbalance, high or low blood pressure, low white blood cell counts, abnormal thyroid tests or prolactin levels, an enlarged prostate, constipation or urination problems, a seizure, glaucoma or cataracts, diabetes, high cholesterol or triglycerides, or liver disease. Pregnant individuals or those planning to become pregnant should consult their healthcare provider due to the potential risks to the newborn. Side effects: Seroquel may cause side effects, including uncontrolled muscle movements in your face, breast swelling and tenderness, nipple discharge, impotence, missed menstrual periods, trouble swallowing, severe constipation, painful or difficult urination, high blood pressure, fast, slow or uneven heart rate, a lightheaded feeling, sudden numbness or weakness, severe headache, blurred vision, eye pain or redness, seeing halos around lights, a seizure, feeling unusually hot or cold, signs of infection. Severe nervous system reaction, underactive thyroid, high blood sugar, and low white blood cell counts. Common side effects may include speech problems, dizziness, drowsiness, tiredness, feeling like you might pass out, lack of energy, fast heartbeats, increased appetite, weight gain, upset stomach, vomiting, constipation, stomach pain, nausea, abnormal liver function tests, sore throat, stuffy nose, dry mouth, or difficulty moving. Always consult your doctor for medical advice about side effects and report any new or unusual symptoms. Interactions: Seroquel might interact with other medications, and using it alongside certain other medicines for infections, asthma, heart problems, high blood pressure, depression, mental illness, cancer, malaria, or HIV can increase the risk of a serious heart problem. Always inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Dosage: Seroquel should be taken as prescribed by your doctor, and it is crucial to follow all directions on your prescription label and read all medication guides or instruction sheets. You may take Seroquel with or without food, but it should be taken the same way each time. Swallow the tablet whole and do not crush, chew, or break it. Your blood may need to be checked on a regular basis, and you may need other medical tests. Your blood pressure may need to be checked often. Do not stop using Seroquel suddenly, as your condition may worsen, or you could have unpleasant symptoms. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid: While taking Seroquel, it is advisable to avoid drinking alcohol due to the potential for dangerous side effects. Be cautious when getting up too fast from a sitting or lying position to prevent dizziness. Avoid driving or engaging in hazardous activities until you know how Seroquel will affect you. Also, avoid becoming overheated or dehydrated during exercise and in hot weather, and ensure you drink plenty of fluids while using Seroquel. FAQ: Seroquel has been used at low doses to assist with sleep, but studies are lacking, and serious side effects can occur. It is not generally recommended as a sleep aid in the general population and may only be prescribed for people with certain mental health, mood, or psychosis disorders. For specific queries related to this medication, it's best to consult with a healthcare provider. Closing. That concludes our overview of Seroquel. Remember, this information is intended to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.